Christopher Nolikin at Bulger Veterinary Hospital.
Hi, I'm Lindsay Renzullo.
Talking today about allergies in pets.
Spaying and neutering your pet.
Pet weight management. And we're going to talk today about pet summer fun and safety. But doctor.
Mm-hmm.
So she says, I got
You're good, girl. You got a lot of
I'm a
treats.
good
A lot
girl.
of TD
Jump
treats.
up on that table. Welcome to the podcast. I'm Dr. Christopher Nolikin.
Hi, I'm Dr. Lindsay Renzullo.
We're from Bulger Veterinary Hospital, and we are talking today about basically management of your pet's finances, or not so much your pet's finances, but the care involved in veterinary management of pets.
Yeah, I mean, it's definitely a tough topic sometimes, just because finances is really a touchy subject for a lot of people and pet owners, because veterinary cost is actually something that's getting really quite expensive. Right. So, typically for a dog or a cat owner, what are you looking at kind of as a yearly basis, taking care of just a dog or a cat?
Yeah, so I mean, I always think of it in terms of your planned care and sort of your emergency needs, right? So if you have an average dog, it really does depend on where in the country you are and what exactly your pet needs every year. But you're going to be looking at probably spending somewhere between $200 to $500 a year for just its routine care. So that's your examination annually, your vaccines,
yep,
your heartworm preventative, your flea and tick prevention,
yep,
that sort of thing.
Yep.
Cats?
Cats probably are a little bit cheaper, just because for the most part cats have less vaccine options, so we don't have as many vaccines for cats as we do for dogs. And as far as like monthly preventatives and things like that, it just tends to be just a little bit more affordable. They're smaller, so a lot of times you're not having to pay a lot more money for larger size items and things like that. So cats tend to be a little bit less expensive.
I'm thinking like $150 to $300 maybe.
Yeah, I think it's probably a reasonable range for a yearly, to take care of your cat per year.
And then other planned expenses that you usually would want to factor in is if you have a puppy or a kitten, having them spayed or neutered, that's going to run you somewhere in the ballpark of, again, $200 to $600 for, depending upon where you are,
yep,
what your pet needs exactly, and what kind of optional things you might elect to do. I think that's pretty much it for kind of routine, pet care.
Routine, you're probably spending a little bit more that first year as far as getting those initial vaccines under your belt, and getting the spaying and neutering done, microchipping and other things. And then after that, you're sort of cruising for a while from year to year.
So then, one comment that I will make is that prevention is well worth it. So you do not want to run into the situation where your dog gets heartworm and now you're spending way more than the lifetime of the prevention that you could have done.
Definitely. Intestinal parasites,
Lyme disease, all of those things.
Yeah, I mean, those vaccines that we give them for a reason. Prevention is very, very important, and it can be a lot more costs can sort of be added to your yearly expense if you don't vaccinate appropriately.
So then there's the medical sick pet care, which really is more the bulk of the issues that we kind of run into as vets, because I think that a lot of the time you go to your vet with an idea of what you're going to spend for the thing that you have gone for, and you might think it's a very relatively simple thing, and you're spending way more than you expected. So you do a lot of emergency.
Yep.
When you think of, I'm seeing this animal that's kind of vaguely ill and maybe it's having some vomiting, so maybe we're just going to do a couple of things. We're going to do some blood work, maybe we'll do some x-rays.
Yeah, I mean, gastroenteritis or vomiting and diarrhea is one of the big emergencies that we do see, and so you have those patients come in, and just to sort of have an emergency exam visit, do some blood work, do some x-rays, you're looking around $600 for a total of all of those things. The blood work and x-rays each are around $200+ again, depending on where you live in the country. But in this region, near Boston, that's not unreasonable to be thinking that's how much money you're going to be spending. And that's just the diagnostic portion. So that's just basically doing some tests to figuring out, why is my dog having vomit? Why is my dog vomiting? Why is my dog having diarrhea? And then from that, we have to make up a treatment plan to kind of help your dog get better.
So then all-in costs, let's say your dog is more significantly ill and needs to be hospitalized. So for that same gastroenteritis, we're not doing anything major like surgery or anything like that, but we're hospitalizing it for a couple of days and giving supportive care and fluids, what do you usually estimate?
So yeah, I mean, some of these dogs can come in and they're really sick, they're really dehydrated, and yeah, they might not need a surgery or anything else, but they do need some pretty intensive care. They need, 24-hour nursing, they need fluids, they need medications to make them feel less nauseous and help with their diarrhea. You could be looking at, for a normal-sized dog, $2,000, $2,500 easily for that dog if they're really sick and need to spend a few days in the hospital.
And then if let's say they have a foreign body, so now they need to have surgery plus all of those things.
Yeah.
You very commonly probably are giving estimates $3,500 to $4,000 total.
It's true, and I think that we're so used to it as veterinarians, and because we work in that field, and we understand that everything that is involved in those types of cases. But that kind of treatment plan, that expenditure definitely is something that takes a lot of people by surprise if they're not used to it.
Right. So then the high end the highest that I think an animal has ever spent, who knows?
Who knows?
But we've had cases very complex, like a hit by a car, which is an animal can have multiple areas of trauma. 12,000.
Yeah, I mean, you're talking about, depending on what your pet needs, if there's multiple fractures, if the pet needs to be on ventilation, has significant lung or pulmonary contusions, you could be talking about thousands of dollars to get that pet back to where you need them to be. So it definitely can be a very expensive road, some of the emergency exam visits that you have or that you see, and it can take people a lot by surprise.
Yeah. So then, one question we often get asked is why? Why is it so expensive? Or, why does this particular thing cost this much? Why does it cost $50 for suction or whatever? So you can go down the line and you can itemize each individual thing and say, well, it costs this to do this. But the reality is that you have to look at the total cost as a total picture. So when we are, writing up an estimate or taking payment for things, roughly 50% of any money that most veterinary businesses take in goes to staff. So vets, the technicians, the receptionists, they're all very highly trained in their particular fields. And so 50% goes directly to paying our staff.
Yeah, and that's a big expense for sure. I mean, you're staffing a facility that's open 24 hours a day. So you're having those people stay all night. And you're not just having, one person that's inexperienced stay all night. You're hiring, and you're staffing, experienced veterinarians, experienced technicians, these guys are staying all night to take care of your pet. So it does add up for sure.
Right. And then, you have other expenses like the medications. So vets are subject to the same exact medication issues that human physicians are. Back orders, the cost of prescription medications are very, very high. And we often are buying the same medications that the human hospitals are and dealing with those same issues in terms of the cost and pharmaceutical prices. Then there's equipment.
And the equipment, I mean, this is something that we don't use majority of the time, special, just made for veterinarian use equipment. We're buying, hospital grade material, things that you would get if you go to a human hospital. We're either buying the next model down or whatever it may be, but we're still buying equipment that can be quite expensive. I mean, for an x-ray machine
or
for a CT scanner, I mean, how much are those? Depending on the type of one that you get, you're looking at like $200,000.
So x-ray, we just bought a new one, $65,000.
That's a lot of money.
Some of the surgical monitoring equipment, each monitor is $6,000. So all of this, it really adds up.
Yeah.
And that's part of what goes into the cost of veterinary care. Whether your pet specifically needs it at that moment or not, it's there for you to choose.
And some of the equipment doesn't last forever. I mean, because we are a veterinary hospital, we do see that equipment getting spit on, like getting peed on, or really dropping it because the dog is, flailing or things like that. So the equipment definitely takes a beating as well. So all of that equipment can be really expensive and add up.
Right. And then finally, maintaining a building, maintaining a facility can be costly. And we have to be there. At our facility, we're there 24 hours. So we're there, our lights are on, our building is there. Whether you are coming in right at that moment or not, we are costs to build a veterinary building are certainly in the multiple millions of dollars. Depends on the specific size and type of building. The lights have to be on. It has to be maintained. There's maintenance, a lot of maintenance costs. So all of that at the end of the day, I'm going to just say it, we're not a nonprofit business. So veterinarians are needing to make at least some profit to stay a business, or they're going to close down. So there is some profit involved. It's not a large profit margin in veterinary businesses, but that is part of the revenue.
Yeah, yeah. So, I mean, that sort of is an important thing to understand. And then from that, we have to figure out ways in which, we can help owners, or that owners can kind of take on those costs. And so, there are a bunch of different options that people can options they can pick when dealing with a veterinary bill that's a little bit more expensive than maybe what they were initially thinking. And so, what are some of those options, Krista, that people have?
I think still the most common is just paying outright. So, most businesses take different forms of payment. You can pay with a credit card, and if you can absorb that cost, right? So it's not a big deal for you to spend in a shot $4,000 possibly. That's perfectly fine.
Right.
I think that fewer and fewer people are capable of that, but that's certainly a way to do it.
Yep.
What about pet insurance?
Pet insurance, and we were actually talking before even on air, it's one of those things where we really wish so many more owners would actually utilize it. It is a wonderful resource that we have. There's all different sort of programs that you can, get involved with as far as, different types of insurance packages that you can sign up for. So, depending on if you want a higher coverage, or if you want a higher or lower deductible, it's just very similar to human insurance, as far as that kind of goes. But it typically is a monthly, you pay a monthly bill towards this insurance company, and it really does help in times of, crisis, or if you have an emergency. It's wonderful when people have that to sort of lean back on. So there's a lot of different pet insurance companies out there, and all of which are a little bit different, and they have different, price packages and things like that. But it's a great resource, and we are seeing more people with it probably now than we were even 10 years ago, but I still don't think we're seeing the level that we would love to see.
No, and I think that's the thing, that you need to think about this when you get your pet, before you have any pre-existing conditions.
Yes.
The minute something happens, now that problem forever will not be covered, or at least if it keeps recurring.
Yeah.
But really, I don't have issues convincing someone to do what they need to do for their pet when they have insurance.
Yeah.
So, you get this treatment plan, or this estimate that's $4,000, but you know that 90% of it's going to be reimbursed to you. Doctor, do whatever you need. And that's what, it's not like we're trying to do anything more than is absolutely necessary, but, when your hands are so tied by not being able to do anything, having that insurance, just whatever.
It's great. And I mean, if you don't have insurance and you get down to the point where you're there in the emergency room and you're past that point of buying insurance, I mean, there are different types of lines of credit that are out there for people that you can apply for. You have to apply, though, and get approved for each line of credit. And typically it's a certain amount of money that they allot to you, and then it's interest-free over 6 months or so. Mm-hmm. And so that's a great resource as well for some of these owners. And so those are the three ways that we typically, or three options that people typically will go to, when they have, or they're presented with a big bill. And if they can't come up with, let's say, $4,000, what do you do with those clients, Chris, if they come in and they say, I really need, let's see if we can help my dog. Right. What can you do if we don't have that?
Yeah, I mean, that's always the most difficult situation. So there are some times where your ideal plan doesn't have to go forward, right? Yep. So you don't really know, maybe you don't know what's wrong with the pet for sure. You have a gut instinct, and it would be ideal for you to spend, $800 on diagnostic tests to rule out all of these possible things. But in reality, we're going to go with the most common thing. We're going to treat the most likely thing. Maybe we can't hospitalize. Maybe we have to treat at home. It's not going to be perfect. But for a lot of pets, that'll be okay.
Yeah.
When it's not, or when we know that the thing that they have wrong with them is the expensive thing. So let's say we know this animal has a ball in its intestines. It needs surgery or it's going to die. Those really are the toughest things. You've got to have a plan. So here's my soapbox. What's not okay, so it's okay to not have the money. It's not okay to show up, don't have any money, your pet needs $4,000 worth of care, and you're not able to make a decision to say, well, I can't afford this, so I might have to let my pet go or euthanize my pet or surrender it to an animal shelter. It isn't our fault, so to speak, that happened or that we can't figure out a way to give you free care. So there has to be some plan. And if the plan is I need to humanely euthanize my dog because it has something that it's going to kill it in a painful way, as sad and horrifying as that sounds, it's the reality. And that does happen.
It does, and I mean, you have to remember that all of us that are in the veterinary field, from the vets to the techs to the client care to anybody that's there, that's working there, we are all there because we love animals. We went to school because we loved animals. So we're there to help you. We're there to help your animal as best we can, and know that any difficult decision that you make is a difficult decision for us too as well. So, making sure that you're utilizing your veterinary team as a partner and trying to work together, and realizing that that we're there for you as best we can, and knowing that is very important.
Mm-hmm. Yeah, because that is something that once in a while we hear this very, it's a really upsetting thing that some people will say is they're just in it for the money. It's upsetting because vets are absolutely not just in it for the money, because for 8 years of education and $320,000 plus that my education cost, I could have been a lot of other things that paid more. Yeah. So vets are just trying to help you. And that's one thing, just want to kind of leave you on with the financial management aspect is we're all trying to help.
We're here for you, so let's work together.
Let's work together.
On a happier note, maybe we should switch topics.
So you had a very cool case.
I had a cool case today. I really did. So this case came to me actually just yesterday. So I was on appointments, and so seeing various clients with their animals, and it was a client that came in that had adopted this older dog. Her name is Doodle, and she is 11 years old, and it was sort of a sad story of how she adopted her, but this owner just said, I know she's 11, look at this little scraggle muffin, she's a great dog, she's super sweet, I want to take her on, let me adopt her, and she did. And so she took it out of the kindness of her own heart to adopt this little lady. And when she brought her home, she said, oh my gosh, you're covered in mats. She is a doodle of a dog. She's a golden doodle. So she's got a lot of that kind of scraggly hair. And she had lots of mats everywhere. So she went to the groomer. First thing, was just, let's go to the groomer immediately. So she went to the groomer and got her shaved down. And that's what we found. So she obviously looks a whole lot happier and better that she's, got all that raggle muffin.
She'll grow in before winter, right?
She'll be a little cold. She might need to wear a sweater. But after she really got shaved down, it was very, very noticeable to this owner that, oh my gosh, she's got this massive growth on her eye. So she came in to see me for this just gigantic growth on her eye. And so it looked very, very ominous, and she didn't know what to do. She actually went to another vet hospital and said, oh my gosh, you need to go to Bulger and have this checked out. So she came in and saw me, and I do, as we've talked in previous episodes, love ophthalmology. So I saw this case and I said, oh my gosh, we can definitely help you out. So we did surgery today on that. And what we did is we took off that eyelid mass, and it was a little bit concerning because you worry about the eyelid margin. But
look at how pretty it looks.
That is after.
I mean,
that's
you might
dirty.
not think that it looks pretty, but without that mass there.
But the mass is gone, and the eyelid margin came together beautifully. And so even though she still has got a lot of that pigmentation around her eye from just the irritation of that mass, and we shaved it and cleaned it.
It's shaved and cleaned.
Yeah. She'll, when that grows in, you're never going to even notice that she had that mass there. So it was sort of a feel-good story for today because this wonderful woman adopted her, and she had this big thing that was bleeding, and now she's got it off. And before I left to come here, I just checked in on her, and she's sitting up, wagging her tail. She got her her wonderful little cone on. But
Well,
yeah,
she
so
doesn't have
she
the mask on,
yeah, she doesn't have that, yeah, there. But that's the before picture.
So since we were talking about costs, what would that usually cost?
So we did not only that mask, but we had another mask on the other eye too. It's smaller, you can't really see it that much in that picture. It's on the lower lid. And then she had another mask on her shoulder as well. And so we did all three of those things. We put an IV catheter in, gave her sedation, clipped and cleaned all those areas, removed it all. That is me doing surgery. And the cost of that was around $900.
900, yeah.
So I mean, it's expensive, and I didn't even charge her as much surgical time as far as it took me, just because she had just adopted this wonderful old lady. So I actually, charged her for.
We are nice.
We are nice, not enough money. So yeah, we charge her for a lower surgical rate too as well, because she just adopted this old girl. So I'd asked the mom if she minded me sharing Doodle's story, and she said not at all. And hopefully it's going to help promote older dog adoption in the sense of she's a wonderful, sweet dog. She's potty trained. She just needed some TLC and stuff. So so that is the story of Doodle, and we really liked the cases. So we're thinking that maybe we would kind of incorporate this into our our segments as well, as sort of do like either a case of the day or things like that.
So we did have one client question, which was about nose chapping.
Yeah.
So in the wintertime, do dogs get chapped noses? And so it was an interesting question because I don't think about that very often.
Yeah, I don't either. I feel like a lot of times when we think of chapped, anything, we think of like chapped lips, that you get chapped lips in the wintertime, licking their lips a lot. Sometimes our hands get really chapped, in the wintertime too, when the air is a little bit drier. And dog skin is similar to people's skin in some ways. The nose is a mucocutaneous junction. It can get drier. It can sometimes have the appearance of chappedness to it, but it doesn't always indicate that same chappedness that we think of with humans. Sometimes it can actually indicate more of underlying, like a disorder of either a metabolic disorder or a skin disorder of sorts. So it's not necessarily the same chap that we're thinking as far as
I mean, they'll get, like, if you crate them, they'll get a little, like, abrasion there on the nose if they're, like, rubbing their little noses. Their noses are generally, like, a lot tougher than our skin or lips or anything. So, but there are those dogs, and it's completely different than really chapped, those dogs like boxers and animals that get a really thick, kind of gnarly-looking nose. That's an issue of that they don't actually exfoliate their nose.
Yeah, and it's like more of like that hyperkeratosis.
Yeah.
And so you can get those dogs, and especially those brachycephalics, the smushy face dogs, the short nose, the short muzzles, that can get really kind of gnarly noses. And you can put, moisturizing creams and such on them. Aquaphor is a favorite of mine.
Vaseline.
Yeah. And I think there's even like a company that's called like Snout Pout. That's very similar to like, an Aquaphor-based type of solution that can help hydrate the nose.
For those smushy face dogs, there are more specific treatments that you should, usually talk to your vet about. There's, treatments that can actually kind of help them to exfoliate and soften up that little nose a little bit.
Yeah.
So then you also had a product review.
I did.
/ local business discussion. So you want to talk about these things?
I do. So this is another thing that we haven't done yet on the show that I think would be really cool to do, is sort of do like a little local highlight on a store or somebody that's basically doing something locally that we can kind of focus in on. And so this is Doug and Happy. These are homemade dog toys. She does various patterns. The owner's name is Amy. She does various patterns with this felt and makes these homemade dog toys. And she's out of Quincy, so it's South Shore. But we have
Isn't it Quincy?
Is it really pronounced
I don't
Quincy?
know.
Oh,
I'm not from around here.
Set.
You are.
I always say Quincy. Quincy.
It's Quincy.
Well, that being said, I might be wrong. But she is out of there. But she does ship, so that's fine.
Sorry,
she
I
can
derailed
ship.
you.
It's fine. It's totally fine. And so they're super cool because they're homemade, and I love local businesses. I love supporting local businesses. And so they're a lot of fun. I did try it out with my little dog Lola, and she loved it. And as far as your dog at home, if it's going to be something that your dog likes, I just always say any type of toy, especially if you don't know if your dog is going to completely destroy it and rip it up and ingest it, make sure you're monitoring and supervising your dogs. Because these toys, any kind of rope toy or toy that you can possibly pull apart, you want to make sure you're keeping eyes on your dog.
But they're very cute.
Super cute.
Yeah.
And homemade, which I love. So, yeah, Doug and Happy at Quincy or
Quincy.
Quincy.
I hear.
Quincy.
I don't know.
Yes. It's stugandhappy.com. So that's that. And so that's really our episode for today's podcast. Don't forget, you can always email us questions if you have any questions. And we look forward to seeing you guys next time.
So we'll see you the next time. I'm Christopher Nolikin.
Lindsay Renzullo. See you later.